Hello, my name's George from Allied Medical Group. Today I'm going to show you some of the equipment that our staff carry in events. We have two types of equipment. We have the clinician's kit and the first responder kit. This ensures that the right equipment is taken to the right patient. Today we're going to walk you through the first responder kit bags. That's the Entonox bag and the first responder bag. This equipment provides an initial response to every patient. The first responder bag is noted with this label, and in the rear compartment you will find a stock sheet which has photo references just in case you forget where equipment's stored. The outside pocket on the bag contains a bottle of water, and then the main compartment is sealed with a green tag so you know it's stocked. Inside the main compartment is an adult bag valve mask and a LifePak 1000 AED, along with a set of adult OPAs in the main compartment. Moving into the main compartment of the bag now at the front, you've got eye wash pods, gauze, plasters and wipes, trauma bandages and 4 blankets, conforming bandages with tape. In the lower part you have ice packs with more triangular bandages, and then in the front pocket you have extra large plasters with alcohol sanitizer. So we'll now move on to the Entonox bag, which also has the label on the front to identify it. Inside the main compartment you have the Entonox giving set. You have the disposable mouthpieces that attach, and the Entonox cylinder itself. That is all the equipment that our first responders will carry during an event. Today we're going to go through the clinician's equipment that you'll be issued on an event. It composes of the primary response bag, which contains all of the standard equipment such as oxygen, dressings and cannulation kit, the medicines bag and the LifePak 15 monitor defibrillator. Today we're going to walk through the clinician's equipment that you'll carry on events. We're starting with the primary response bag. This bag is designed to mirror our local ambulance service to provide operational efficiency if we are jointly working together on an incident, with 1 or 2 small variations. The start of the bag we have the sharps bin and the clinical waste bag. Then to the left of that we have the dressings pouch. This carries all of your normal gauze swabs, eye wash pods, tape, plasters and wipes. In the lower pouch at the front of the bag we hold our intravenous fluids module, which has 2 bags of sodium chloride and a bag of glucose and some giving sets. Also within this pouch we have trauma equipment such as hemostatic gauze, trauma bandages and tourniquets. As we move into the main compartment of the bag, you'll see that all the pouches are identifiable by their labels. So we start with the intravenous access pouch. This has all the equipment in to administer medications to a patient. Above this pouch we have our airway module, which carries eye gels, OPAs, MPAs and all the accessories that you need to support the patient's airway. On the reverse side is where we keep our oxygen cylinder down the centre, and then our adult and child oxygen masks with the appropriate BVM underneath each one. That's all the equipment that we keep in our primary response bag. Today I'm going to walk you through the LifePak 15 monitor defibrillator. So this is our primary monitoring machine for all patients. This has the capability to do blood pressure, SpO2, 3-lead, 12-lead ECGs, as well as provide pace into the patient. You'll find the observations equipment on the left-hand side of the monitor with your SpO2, your ECG cables and your non-invasive blood pressure cuff. And then the 12-lead ECG cable is in the left-hand side pouch, along with the electrodes. The right-hand side of the pouch contains the defibrillator pads, razors, tough cuts, as well as the capnography filter lines for cardiac arrest and nasal capnography. The outside pocket on the right side contains the blood glucose testing machine and the thermometer, and then the rear pouch at the back of the LifePak contains all of the spare blood pressure cuffs. That's all the equipment inside our LifePak 15. And today I'm going to show you the medicines bags that we give to our event staff. The yellow bag is our standard clinician's medicines bag, with the red one being for specialist practitioners. In the rear of the bag you will find the paperwork, which contains all the information about the medicines within the bag, such as the batch and the expiry. If you sign out any of the medicines, please ensure that you include your PIN number if appropriate and the PRF number associated with the medication. In the main compartment of the medicines bag, you will find the panels that fold out. The inside of this one contains 2 IV paracetamol, and the reverse all of your cardiac arrest drugs, 1 in 10,000 adrenaline and amiodarone pre-filled syringes. The other side contains all of your flushes, sodium chloride and water for injection pods. All of the ampule medicines are in the top that are labelled, and the rest of the medications are stored in the pouches shown here. The red tear out pouch is sealed with an EZ-IO gun for intraosseous access. And then the controlled drugs module in the sealed red pouch for all of the controlled drugs that you will carry if appropriate. That's all the equipment inside of our standard clinician's medicines bag. Today I'm going to show you the specialist practitioner's medicines bag. This bag is different from the standard clinician's medicines bag as it is a red bag and has the label on the front. Within this bag you will find enhanced medications for urgent care, primary care and emergency care. Enhanced analgesia and controlled drugs can be found in the yellow pouch marked with the controlled drugs label. We have other things such as Penthrox and a wide range of antibiotics and other useful medicines to treat those conditions at events. And today I'm going to show you the paperwork that is carried at events. We have 2 kinds of paperwork. One of them is the operational command folder that's carried by our operational team leaders, and the second one is the paperwork wallet in the cab of every ambulance. Within the ambulance paperwork you'll find a QR code sheet, vehicle's fuel card, paper PRFs, envelopes, and you'll also be issued an iPad to complete our new patient report forms electronically. However, we do retain paper just as a backup. The QR codes provide information on the vehicle daily inspection, incident reporting, safeguarding concerns and where to access the fuel card stations. The operational team leaders will carry a folder that looks like this. This folder contains major incident folder to make decision logs and share decision making recordings. Various information about communication with various responders, people in crisis, the JESIP principles, further information about major incidents such as ambulance login, patient login, as well as escalation contingency plans. Each ambulance also carries a 10-second triage pouch in the glove box which contains a multitude of triage bands and the diagrams below. That's all the equipment that we carry for paperwork on events.